Your body's nasal humidifier. Cold, dry winter air dries out your nose, throat, and lungs. This is one reason why the flu and virus are worse during the winter months. In the winter, the air is dry and cold, which dries out the protective mucus lining your nose, throat, and lungs, leaving them more vulnerable to bacteria and virus attacks. A dried out mucus lining can stop your body from removing virus particles. Your body's air filter that removes virus particles needs 45% humidity in the air you breathe in to keep your mucosal lining hydrated so it can remove virus particles from your nose, throat, and lungs. Your nasal cavity warms and moistens cold, dry winter air. Breathing through your nose warms and moistens the cold, dry winter air going into your nose, throat, and lungs. Mouth breathing sends cold, dry winter air directly into the throat and lungs. So your nasal cavity is like a built-in humidifier that warms and humidifies the air that you breathe. In the winter, your thirst response is reduced, so you need to schedule drinking water throughout your day to help your body have the water it needs to humidify the air you breathe in through your nose. The nasal cavity can also trap some of the virus particles, preventing them from going down into your lungs. Your nasal cavity also produces nitric oxide. Nitric oxide helps increase blood flow and oxygen in your lungs. Nitric oxide is also an antiviral that fights viruses. When you breathe in through your nose, you inhale nitric oxide created by your nasal cavity into your throat and lungs. If you breathe through your mouth, you don't get the nitric oxide. Nitric oxide increases the size of the arteries and airways in your lungs to help increase blood flow through them. It also helps increase the amount of oxygen in the blood and helps relax the lungs to make it easier to breathe. Nitric oxide has been shown to help prevent flu viruses from multiplying as well as fighting parasites and bacteria. Nitric oxide also helps prevent blood clots and high blood pressure, working with your body's systems to help keep you healthy. The nitric oxide created by your nasal cavity is the same nitric oxide that you would get in the hospital. Your nasal cavity is continuously creating nitric oxide, but you must breathe through your nose to deliver it to your lungs and body. If you want to increase the nitric oxide in your nasal cavity, you might try humming. They've discovered that humming increases nitric oxide production in the nasal cavity 7 times. So this is one of the reasons that when you have people who are meditating, they go hum. It's actually increasing nitric oxide when they hum when they're meditating. Hum. So they hum on the exhale and breathe in through the nose. So humming on the exhale will increase the amount of nitric oxide that your nasal cavity produces. Cold winter air can also reduce the movement of your cilia, which can slow down the amount of virus your body's able to remove. Let's take a quick look at how this works. When you breathe in virus particles, they land on your nose, throat, and lungs. Your body has a built-in air filter that removes virus particles but needs water to operate. It needs water to float the virus particles up to the top of your throat where they are swallowed and then dissolved in your stomach acid. There is a limited window of time between when the virus particles land and when they infect your cells. Before they infect your cells, they can be removed as virus particles. After they infect your cells, your infected cells must be destroyed. Your body has a 2-step defense against virus infections. The first step is to remove virus particles before they can infect you using your body's built-in air filter. It is your body's first line of defense against airborne virus particles. The second step is to attack infected cells that the first step missed, to destroy them using your body's attack immune system, which must research a new virus before it attacks it. This can take multiple days, during which time the virus multiplies. Your body has 2 immune systems, the innate and acquired immune system. The remove virus process is part of your innate immune system. The attack virus process is part of your acquired immune system. Your body's remove virus process is non-specific. This means it removes all variations of a virus, even those in the future. Drinking water before, during, and after going to activities where you might breathe in virus particles helps your body remove more virus particles before they can infect you, so you have less virus to fight, less virus to spread, and a less severe case. So reducing the amount of virus particles inside your body reduces the amount of virus your body has to fight, reducing the severity of your case. Washing hands, social distancing, and wearing a mask are 3 current virus protocols to help reduce the amount of virus particles entering your body. We would like to suggest drinking water before, during, and after activities as a 4th virus protocol to help reduce the amount of virus particles inside your body by removing them after they have entered your body. Drinking water before, during, and after going to an activity where you might breathe in virus particles helps your body have the water it needs to help float and remove virus particles from your nose, throat, and lungs. To learn more about how your body's built-in virus removal system works, please click on the video link or go to hydrationhealing.com and click on Webinars in the menu to watch it. This 7-minute video shows how you can help your body remove virus particles before they can infect your cells so you have less virus to fight, less virus to spread, and a less severe case. You can also research the medical name for your body's built-in air filter, which is your mucociliary escalator. That's mucociliary mucociliary escalator. If you enjoyed this video, please share it with your family and friends and on social media. Please consider watching the 7-minute video, especially the last part that illustrates how all this works. Thanks so much for listening. Stay safe, stay healthy, and we'll talk with you soon.